The difference between liver transplantation and any other surgery that we perform is that a liver transplantation is offered only for those subset of patients which have got no other cure. For them, there is absolutely nothing down the road but a transplantation. You have to understand that on one side, there is a 100% chance of death without a transplantation. And then on the other side, there is a transplant which has its own success rates. So you cannot compare liver transplantation to any other surgical procedure. It might be variable. You have to look at liver transplantation on the background and understand that the chances of survival without a liver transplantation are absolutely nil, and the liver transplant is the only option that you have right now. On that background, if you understand about the results of liver transplantation, so the results of liver transplantation can basically be looked at into two subgroups. One is the short-term results and one is the long-term. Short-term results means that during the immediate surgery, how is the patient going to come out of the immediate surgical procedure, that is the first month after transplantation, and the long-term is the latter part after transplantation. So liver transplantation, being such a complex procedure as it is has its own set of complications. The major one of these complications are major infections, rejections, the vessels that are being joined inside the body, those vessels getting blocked off. So if you attribute all these complications, so the immediate success rate of a liver transplantation in the best of centers around the world is about 90 to 95%. So out of every 100 people who have a transplant, about 90 to 95 are going to make it through the immediate period after surgery. So that is about the short-term results of liver transplantation. Now about the long-term results of liver transplantation, the liver is a foreign body that has been placed inside a body, and your body will do everything to reject that liver out of your body. So to suppress the immune system of the body, you will have to be on immunosuppressive medications for your life, and these immunosuppressive medications are not the safest medicines available around. They have their own set of complications. They can affect your kidneys, they can affect your cholesterol levels, they can cause various infections to develop inside the body. So in the long term, a lot of complications that will be attributed to your liver transplantation will be because of the side effects of these immunosuppressive medications. So once you've been through the acute phase of the short-term phase of a liver transplantation, the long-term problems will be mainly related to the immunosuppressive medications that you're taking. And none of these long-term complications are not manageable, in the sense that most of these problems can be managed by adjusting the dosage by the other methods. So by and large, the long-term results of liver transplantations are very good, and after you've passed through the early problems of a transplantation like infections and rejections, so you can expect to have a normal lifestyle, and you can expect to have a normal life ahead of you after a liver transplantation. You of course need to be on regular follow-ups. You will need to come to the hospital maybe once or twice a month, or if not come directly to the hospital, you might have to get your blood test done and send them to your doctors. There is no major hindrance after liver transplantation that is going to stop you from going about your normal lifestyle in the long term.